Welcome and thank you all for joining us for today's presentation, which is the Gateway Projects for the Environmental Exposure Data and Aging Research with Dr. Jinkook Lee. Today's presentation is brought to you by the Social, Behavioral, and Economic COVID Coordinating Center, or SBECCC, at ICPSR. And with that, I'd like to introduce today's speaker. Dr. Jinkook Lee is a research professor of economics and the program director of Global Aging, Health, and Policy at the Center for Economic and Social Research at the University of Southern California. Her research focuses on the economics of aging with interdisciplinary training and expertise in large-scale population surveys. She has developed and led the Gateway to Global Aging Data, spearheading data harmonization across the health and retirement study and its international network of studies, and leads the Gateway Exposome Coordinating Center, GECC, integrating contextual data, including historical policies, physical, chemical, and social environments, and studying health and aging. She laid the groundwork for studying Alzheimer's disease and related dementia and their risk factors and impacts in low and middle income countries by developing the Harmonized Diagnostic Assessment of Dementia for the Longitudinal Aging Study in India. LASI-DAD is the country's first and only population representative cognitive aging and dementia study. Its study protocol has been influential in developing cognitive aging and dementia studies in other low and middle income countries, including Kenya, Nepal, Pakistan, Bangladesh, and Malawi, as well as other high income countries. She provides scientific advice for the World Health Organization, the United Nations, the Organization for Economic Cooperation and Development, the World Bank, and the Asian Development Bank, and serves on the editorial boards for several scientific journals. She received a Ph.D. from The Ohio State University and a BS from Seoul National University, and previously held professorships at The Ohio State University and the Pardee RAND Graduate School. With that, Jinkook, I'll turn things over to you.
Thank you. Thanks for the opportunity today to present the Gateway Exposome Coordinating Center. It is a great pleasure to be here and introduce our new center. It was launched last August 1st of 2024, so it's a pretty brand new center. And it is an interdisciplinary project that aims to advance ADRD research by providing hub for various exposome data, which I will introduce today. And it is funded by National Institute on Aging. Actually, I see my program officer, Emerald, here in this core. I'm one of the MPIs of this project, and you can see my collaborators, Dr. Sarah Dar at University of Michigan at your school, and Dave Knapp at USC. And we do have complementary skill sets to provide and lead the center by bringing various experts and stakeholders across different disciplines. Sarah Dar is an environmental epidemiologist, and Dave Knapp is also leading the Gateway Policy Initiative, and he's an economist. So as a team, we try to reach out to various disciplines and engage stakeholders with who tend to speak different languages in terms of various interests and the way that study various exposome and aging research using different set of tools. But our end goal is the same here, to improve the understanding of ADRD and its risk factors, but also stimulate the science, not only by our team, but larger research, by reaching out to the larger research community. So here, I think the first order of business is to determine or to introduce what the exposome is. So I think it is actually our Gateway Exposome Center is positioned very uniquely by defining exposome much more broadly than exposomics that has been discussed, rooted from more environmental epi world. So in our case, we are really presenting and thinking about environmental exposures from in various spaces, from home and work and neighborhood, as well as communities and nations over the life course. And aging is a process, and a lot of times older generations of researchers tend to focus on thinking about aging in later in the life. But I think it has been very well recognized now that aging is indeed a process that starts with our birth. And a lot of the risk factors has been formulated over the life course, and understanding when various exposure to different stressors happens and with exactly different timing may have an influences, and it may also accumulate over time. So this understanding of trying to understand the exposure to various environmental factors that ranges from more immediate family environments to much macro level policy environment is what we are trying to develop a understanding, and especially thinking about these various risk factors. Our goal has been really thinking harder on its interrelations beyond the single risk factors. I think that sort of distinguishes us from prior approaches, looking at risk factors more as each item one at a time. But in our cases, we are trying to understand the interrelations across different risk factors and how it combined together and influence our risk. And especially the center itself has been anchored at thinking about the dementia risk, AD and ADRD risk. And I think a lot of people have seen this LASI Commission's nice diagram recognizing the importance of life course approaches, that early life exposure to early life risk factors such as education will have a long-lasting impact on later life dementia outcomes. But what has not been fully recognized by the LASI Commission's approaches to risk factors is the interrelationship across different risk factors. So I think that's a lot more research can be done in thinking about those interrelated exposures. In our cases, we have put particular emphasis on 6 different domains that our team is putting energies on. So for example, we put a lot of emphasis on thinking about physical environment and natural environment, such as extreme heats and precipitation, various physical environments such as air pollution, to like access to blue space or access to green space. Our work has been putting a lot of emphasis on understanding policy environment, as policy determines the boundaries of what's available and what can be afforded. And tied with policy environment, we've been also putting a lot of emphasis on the community level information in terms of accessibility and affordabilities. And of course, the social environment is another important environmental factors we study. And all of this is at an individual level experienced, and those life experiences are captured in a variety of different ways through the traditional survey types of the data, but also in more recent years, many of those life experiences are actually captured by various mobile sensors or electronic record or other record. So as I emphasized that there has been big paradigm shift that our team is particularly paying attention to is those interrelated exposures across different domains, and then necessarily brings many of the investigators across different disciplines and working together to better understand. So we had a recently communication, especially thinking about physical environments. In that discussion, we actually brought in a lot of people in the policy area, thinking about environmental policies to environmental scientists who actually measuring like air pollution and green space, to the social scientists who's defining the places and how what would be the unit of the space that people tend to live and interact. When we think about this exposome, because it's defined so broadly, there has been various challenges that we've been thinking about and dealing with. So first of all, as we defined it, exposome is really vast. So it requires many different experts to need to collaborate and work together to better understand. But as many of those disciplines tend to be speaking within their own disciplines and often there is a barrier and many of the data has been siloed. And we try to break that out and develop a better communications, but also that leads to more consistent definitions that will enable further discussions with comparing and discussing, clarifying the different findings from various disciplines. We also try to remove any sort of the inefficiencies as many of the work is done multiple times by different disciplines, and try to also share the innovations brought in by different researchers and different disciplines and make those kind of innovation more widely available. And many of this work has very complex research questions that requires the methodological advances. So our team is putting a lot of emphasis on methodological advances and working on those problems together. And finally, we try to also bring in various constituencies outside of the academics, actually trying to hear the perspective from the industry and various nonprofit organizations and hear about their concerns and communicate our findings with them. And most importantly, just as with the Gateway, our philosophy is really trying to work together through open-minded collaborations and making various data, but also the method available, and through the transparency and efficiency, hoping to create a bigger impact and facilitating the scientific discoveries and bring deeper insights. So the way that we lay out our coordinating center's goal would be, first of all, identifying the research priorities through consensus building, and then developing a series of guidance documents, because many of those exposome measures are defined differently. We're trying to provide guidances in terms of measurements, guidance regarding the harmonization, and also like a best practice guidances on how to analyze and utilize those exposome data. We also aim to create some of the novel exposome measures, as many of the fields are pretty young. And those fields, we're trying to come up with the novel measures and also redefine measures that would be more conceptually aligned with the theories, and then try to disseminate those open access resources to the broader research community. We also plan to do various capacity building activities through publications and documents, as well as organizing in-person workshops. Many of this work is actually building on our existing center, which is a Gateway to Global Aging Data platform. So as a part of the Gateway to Global Aging Data, we have been building historical policy informations as well as various environmental exposome data such as pollution, physical environment variables, as well as capturing the climate-related variables such as temperature and precipitation. So if I may introduce some of our works that we have done already is inviting you to the Gateway to Global Aging Data website. And if you come to our website, you can actually identify the Gateway Policy Explorer page. And our team has been working on multiple countries and over time and capturing the policy reforms over time. And we have done that for three major policies: retirement policy, long-term care policy, and education policy so far. So building on this work, now GECC team is aiming to go into different policy areas such as health promotions, environmental policies, and other various policies that I will introduce shortly. Another important point that I think in thinking about the United States, there are a lot of variations at the state level. So we do actually collect these historical policies over time within the US at the state level. So people can, any researchers who would be interested in learning more about retirement policies or long-term care policies and education policies at the state level. And we do that also for India, the country that I study a lot. This is an example of one of our documents. So you can, of course, all of these resources are available on our website. You can see the URL here and download the information about detailed policies. And this particular example is showing the own old age benefits across policy changes from 1992 to 2023 and detailing various contributions, eligibility, and benefits of the Irish retirement policies. And you can find this sort of information from each of the countries over time from the Gateway data. The work that our team has done on the environmental exposomes thus far as a part of the Gateway activity is started with the air pollution data. So our team has been working with various environmental epidemiologists who has worked for WHO's Global Burden of Disease project. And the earlier work has been mainly built upon the satellite data. Then we brought in various collaborators across different countries and making our estimate at a much finer level by putting in the ground monitor data from various countries and then further improving the fit, utilizing various topologies and other informations, bringing down the precision of our estimates at the 1 kilometer by 1 kilometer level. And our Gateway's work has been more limited and started with a PM 2.5. Over time, we broadened that up to include NO2s and ozons and nighttime lights and so forth. But now this work has been even also going into further in depth, bringing in more source-specific sources of air pollution for PM 2.5, so forth. So now, as a part of a GECC activity, we are taking this to the next level, further developing the data in a finer geographic level, also helping the various cohorts to link this data to their own survey data. So for example, our team has been training various cohort teams to linking the data using various geographical level, utilizing address information, zip code information, or the GPS locations. And you can see further details again about the exposure data that we have that tracing back to 1980s to 1990s, depending on the type of exposome data, and then exactly where the sources of data are, as well as the methodologies that we brought in to the environmental exposomes. So under the guidance from NIA, for the GECC, we try to bring together various DSR-supported centers and networks and cooperative agreements. So we did have a series of presentations and discussions with the various centers. So I did welcome this opportunity to introduce our centers to your center at today's seminar. And we've been also reaching out to various other constituencies to work together. So process thus far, what we have done is we identified various experts in those key domains that I talked about, and we organized town halls last year. For about 3 months time period, we organized 6 different town halls, engaging the almost 400 participants from more than 100 organizations, trying to identify the priorities in terms of what is important exposome research, what are the gaps that we need to work on and identify. After the town hall, we formed the expert panels for each of the topical area, and those expert panels are coming again from different disciplines for each of the topics, and organize series of the expert meetings through the June for first 3 months of this year. And then last month in March, we organized the GECC-wide workshops for a full-day workshop, bringing in experts from different disciplines and setting the priorities. So for our March workshop, we brought in 87 experts across different disciplines and organizations and developed the priorities that what we need to work on next couple of years as prioritizing activities, as well as during next 5 years during the project time period for the topics that is more challenging and complex. And we are currently in the process of finalizing those priorities and building up the work that we laid out during those workshops. So if I may introduce a little bit more about our current activities, is first of all, we are writing up a couple of papers based upon our first year's GCC activities. Those papers will provide defining exposome broadly and engaging various researchers across different disciplines who are interested in exposome research in nature aging. We are also putting together a special issue of Alzheimer's and dementia, and those would be domain-specific gaps and priorities paper. This special issue will also welcome some of the contributions from other scientists in the wider research community who has been working on the exposome research to maximize our impact. We are also currently creating some of the novel new exposome measures and resources. So for example, we are creating heat metrics at the county level estimates, as this would be our climate group's activity. Similarly, our community's services domain is creating the access to various community services such as civic organizations or healthcare facilities, creating measures, exposome measures for those domains. We're also developing a guidance document. So for example, Our social environment domain is trying to write up a guidance document that is discussing the measurement issues surrounding the residential context that would match the theoretical constructs. We are also developing a methodological guidance, thinking about one of the examples would be like providing guidance document on how to model repeated exposure data in life course research. Another piece that we are currently working on is looking into the biases that coming from the sample across various community-based sample, comparing that to more national representative sample, discussing transportability of the findings. Finally, we are also building the infrastructure that creating the metadata operating processes. So all this exposome data and guidance documents and various data will be shared with the wider research communities. Moving forward, what we are currently doing in addition to the activities I just mentioned is supporting pilot programs. So we recently announced a pilot program, and we were just delighted by the so many high quality pilot application came in. Actually, we were quite shocked that we get 68 applications for our pilot program, which is far more than what we are ready to fund. But a lot of interesting application came in, and one different aspects of our pilot program is that once we select the winning application, our plan is actually matching this pilot recipients with some of the experts in the field, so they can have also mentoring activities can be done throughout for the successful pilot programs. And with as many of these new exposome measures and data and guidance products come along, that we will of course disseminate it through our website and through the publications and various presentations. Our plan is to revisit our priorities in year 3. And in order to do that, we will repeat some of our town hall activities in year 3 and revisit with our experts and see whether science has moved on and whether there are any new and important priorities that we have to be thinking about, and planning another GECC-wide in-person workshop in year 3. So thanks for the opportunity. You can visit our website and see some of the early findings and advice we got from the town halls and our March workshop. Thank you very much.
Thank you so much, Jinkook. That was really interesting. So we do have time for questions. So I want to just open it up. You can either put them in the chat, or you can go ahead and unmute yourself to ask Jinkook directly. While we wait for that to come in, I would just ask. I think that's great about the pilot program and the strong interest that you guys got into it. Is that something that you're planning to offer in future years as well? And would it still follow that kind of similar time frame, with applications being due in kind of early to mid-April, and then would awards kind of be around the same level? Just trying to, because I think that's something that we can also, be happy to publicize that for you guys as well. Though it sounds like you're not having any shortage of interest in that. So.
Yes, thank you, John. Yes, we do have our pilot program. Competition will continue every year. So we will submit the selected applications as a part of our progress report to NIA. So with a year 2 funding, we hope to provide the related funding to the pilot applicants. So I think my worry is there are so many good applications came in. We were shocked to have so many great applications come in, and it will be a shame that we can only fund these studies this year, but we would appreciate publicizing it next year
For
for
sure.
sure.
Yeah, happy to. Any questions for Jinkook? Well, I can go ahead and I'll ask another one. I'm curious, with some of the measures that you guys are exploring, potentially developing. I think the example you mentioned was kind of heat indices at the county level. Um, are you looking at, kind of what measures, currently exist and where there are gaps or where there are, kind of improvements that could potentially be made? I'm thinking about, like the National Neighborhood Data Archive or NANDA here that we have at ISR. And I know that there are others as well. And I really appreciate kind of the focus you guys have on harmonization. And I would imagine that's also something you have to think about when you're identifying what measures, you might want to create, or tweak in some way. And I'm just curious how you guys are kind of approaching that, somewhat challenging, problem. So.
Yes, it is definitely very challenging problems. We do have a scoping review of various these domains. So for each of the domains, for example, physical environment, there are so many different measures, right? So we actually have a lead person for each of our key prioritized areas. So there is a lead for air pollution, for example, and then lead for green space, lead for noise or soundscape. And they are doing the scoping review. And those review will produce a paper of the gaps in the literature or gaps in the data, and then provide if there is no gap, and there would be some spaces, especially in some of the physical environment space, there are so many different sources of data in there. Our team is called guidance and guardrails, so there are a lot of not to do recommendations as well. So we also providing those not to do advices. There are many competing data sources in many of these indexes, and as you said, there are various neighborhood level data sources. And there again, I think our first question is what would be the right unit of the geographic area we should be thinking about. And we did have actually a lot of different competing arguments against whether you should be really looking at the information at the county level, or should we looking at the zip code level, or should it be the neighborhood level. So I think it will be a very interesting series of documents that you can read. And I don't think we can claim that we can do it, all different measures and all different domains. But that's why we had our initial discussion about exactly what to prioritize. So with that expert advice, we trying to do a good job on the items that we prioritize and trying to produce that in first few years, and then revisit what to work on again through the engaging in experts. So I think the bottom line is that we want to deliver that can help the moving the science forward. And we acknowledge that we cannot do a good job on all different aspects. And we want to work on the area that we think most of the scientists agree that would be important to work on. And that's how we would prioritize our efforts for the next 5 years as a part of this particular project.
Most definitely. Yeah, I definitely, was trying to simplify that a little bit, but you kind of raised another important point, which is the context in which, you're asking a research question is also going to depend and influence on what the most appropriate way of measuring something may be. And so, yeah, that adds even further kind of complications to it. But no, we're really interesting and definitely excited to see those scoping reviews. Other questions for Jinkook?
Yeah, thanks for the opportunity. I was originally given 30 minutes, so I prepared a short presentation, but it seems like we have more time than I was originally thought I would have. But I appreciate the chance to discuss, and I would welcome all of you get engaged. We do have various expert groups that are meeting, and many of your collaborators in Michigan, as well as IPAMS. And so I think it would be great to more people get engaged in our activities to have a bigger impact.
Definitely. Yeah, please don't hesitate to reach out if you have, if you're, have specific asks or if there are connections we can, help facilitate. Always happy to do that. Well, I don't want to keep you guys, but I want to thank you all again for joining this great talk, and thank you, Jinkook, for coming and sharing about the really interesting work that you guys are doing. And we will, if we, if other folks have questions, I believe there was your contact information in the email, and it is on your website. We're also happy to connect folks with you directly. But with that, we'll let you guys go, a few minutes early. I hope you have a great rest of the afternoon, and we'll see you guys next time.
Thank you.